like to talk to you a little bit about is the details of the court case which struck down the IFH cuts as being unconstitutional. And I'm not going to speak from a really highly legal perspective. I'm going to speak to it for things that are just practically interesting. Because what you need to know is that the Federal Court of Canada, where this litigation took place, is a very, very conservative court usually. It's very, very unusual for them to make any kind of extreme statements or to be hypercritical of government policy. It's very unusual. So when I show you what the court actually found, it should give you an idea that the court was pretty incensed about the way that refugees had been treated under these IFH cuts. And in doing that, I'll confess to you my personal bias. I'm politically pretty conservative. I'm a fairly right-wing person. So for me to be very upset about a government policy is actually something pretty remarkable. So you should get the idea from those two things that it was a very significant change of policy and one that was not very popular on a lot of quarters. So the court decision came down on July 4th, 2014. Okay, what did the court do? They declared that the government's changes to the interim federal healthcare policy were unconstitutional. And they found them unconstitutional not only on one section of the Charter of Rights and Freedoms, but actually on two separate sections of the Charter and Rights in the Charter of Rights and Freedoms. Now, when the government argued their side of the case, they put forward 4 objectives. They said, well, the reason that we've made these cuts is because, number one, the cost is increasing. Okay, so Samantha talked about that earlier, that the costs were, I think, somewhere in the nature of about $90 million per year to run the interim federal healthcare program. So cost savings was a big issue for them. The second one that they mentioned was that they said it's not fair to Canadians because working Canadians get less health care coverage than a refugee who's covered under interim federal health care. Okay, that's what they said. We'll get to that later, whether that's actually true. The third thing was they said we of course want to still protect the health and safety of Canadians, which obviously they tried to do that by giving refugees the basic coverage of at least, you know, if you've got something contagious, well, we'll treat that. I mean, you can drop dead at the hospital door, but as you know, if you're contagious, we'll give you something. And finally, protection of the integrity of the system. What does that mean? I'm sure you've all heard this continuing narrative in the press about bogus refugees. Everybody's talking about bogus refugees. This idea that there are hordes of people out there waiting to overrun our country who are completely fake and who are taking advantage of our system. So that's what they mean when they say protecting the integrity of the system. Well, what did the court actually find? In the course of the litigation, there was a lot of expert evidence that was led from sociologists, from medical professionals, and from people, actual refugees who had been experiencing the negative effects of these cuts. There were also several government witnesses, high-level policy people, who filed affidavits in the litigation, which meant that they could be cross-examined. So a lot of information came out through this expert evidence and the cross-examination of the government witnesses. So one of the things that came out of this cross-examination of the witnesses is that the government made this claim that in the first year of the IFH cuts, they were going to save $70 million. How were they going to save $70 million? They were going to deter bogus refugees from coming to Canada to take advantage of our healthcare system. But when pressed under cross-examination, it came out that the government had never actually done a study which would prove that there would be any cost savings to the taxpayer, because basically what it involved was you would take, the federal government would save that cost, but then it would push it onto charities, it would push it onto provincial healthcare systems, so that you and I, at the end of the day, are still paying the same amount for this healthcare because you close a door and open a window kind of thing. It's just pushing the cost elsewhere. The second thing was that there was actually, nobody had done a study whether there were any refugees coming to Canada because of healthcare. There was actually no empirical evidence to show that that's even a draw for people. So these people were making these bald statements as if they were factual, but when you push them on it, there was nothing underneath it. There were no studies, there were no pieces of empirical evidence, there was no data to prove that any of that was true. And as Samantha alluded to earlier, a lot of the problem is that some refugees will have very simple, minor health complications that if you would just treat them with a $20 asthma inhaler or a $30 bottle of insulin, it would take care of the problem, versus them not being able to get the inhaler or not being able to get the insulin and ending up in the emergency room, which costs us, the taxpayer, 100 times more than it would to just pay for their $20 inhaler. The other thing that the court found was that some people were being forced out of, so refugees who were working and did not have health care anymore could not afford to buy the medications or the care that they needed, but if they went onto welfare, welfare would pay for it. So you were in this stupid situation of forcing people from jobs and paying taxes into getting social assistance. And do you think that that saves us, the taxpayers, one single dollar? No, of course it doesn't. It actually costs us more money. The court found overall that the impact on refugees was serious and devastating. Not only on a medical level, but also the psychological impact of having to quit their jobs and go on social assistance in order to get the medication that they needed, which is obviously, you know, very demeaning to your dignity as a person if that, you know, if you're able to work. And also the psychological impact of never knowing where your medication is going to come from. And Samantha mentioned earlier about, you know, one person that she knew that, you know, going to the pharmacy and never knowing where your next dose of medication is actually going to come from, or if you're going to get it or not. The court did a lot of examination about the downloading of these costs. So the government tried to argue that, well, since we've cut IFH, people are still getting health care. They're either showing up at hospitals and doctors are doing it for free, or they're going to community health care centers, or the, you know, charities are providing this service, or some of the provinces, you know, issued a stopgap policy to cover it provincially. And the court said that, well, the problem is that you can't rely on any of that. I mean, how degrading is that to your dignity if you're a seriously ill person to go begging to charities to be able to get your simple medication and basic health care? Now, the people who brought the case forward argued 3 grounds of charter rights. Number 1 was life, liberty, and security of the person. The court disagreed on that one for some technical reasons. The second ground was cruel and unusual treatment, which has pretty much never been used in Canadian litigation, except when you're talking about people going to jail or death penalty or something like that. The court agreed that this is cruel and unusual treatment. And the third ground was discriminating against people based on their nationality and based on the type of refugee that they are. So inequality and discrimination, and the court agreed with that too. Some interesting statements by the court, and again, this is going back to what I said to you earlier about the court is not given to making these kinds of extreme statements. So it's a little mind-blowing that they said things like this. For example, the judge said, "The government has intentionally targeted a vulnerable, poor, and disadvantaged group for adverse treatment for the express purpose of inflicting predictable and preventable suffering." That's a very, very extreme statement for a pretty conservative court to make. The judge said that there's no evidence of any kind that Canadians were getting better treatment, or Canadians were getting less, refugees were getting better treatment than Canadians. That was one of the arguments that the government made. Why? Because, you know, for those of us who work and who make an income, we know that when we get a prescription from the doctor, we have to go to the pharmacy and pay for it, right? But the thing is, you're comparing apples to oranges, because if you're somebody who's in Canada who's on social assistance, the government does pay for that medication, right? So refugees who are indigent, these are low-income people. So low-income refugees and low-income Canadians were getting treated exactly the same way. You can't you can't compare a low-income refugee to a high-income Canadian. That doesn't make any sense. So the court said that it's just a nonsensical argument. The other thing was the government had clearly not done any studies whatsoever on the effect of this on kids. They're saying you're trying to deter bogus refugees, but what about kids? Like, the kids didn't make this decision to come to Canada. It was their parents who made that decision. So are we going to punish little kids who had no control over this situation for the decisions of their parents? And finally, the court found that the government had made zero effort to actually find out whether this was a deterrent to these so-called bogus refugee claims. So there was no study done as to whether this would save anybody any money. There was no realistic fact check as to whether this was resulting in any inequity between Canadians and refugee claimants. There was no study as to the effect on children, and there was no study as to whether healthcare was actually forming an impetus for people to come and make these so-called bogus refugee claims in Canada. So those are my comments about the court case, and I guess we'll move to questions.